Hi guys, this is Andrew Swan from the Eye Center of Southern Connecticut here in Hamden, Connecticut. Just giving you a quick COVID update for our practice. We are now in mid-August and we have been back in practice since the end of May here in Connecticut. That said, we have had a very good outcome so far in regard to balancing the demand for patient examinations with the need to keep everyone safe. So we are continuing with our process of checking every single patient and staff member every morning for a temperature, and also performing screenings on all patients in regard to travel history and exposure history to the COVID coronavirus. If you come to any of our 3 locations in Hamden, Cheshire, or Branford, you will be asked to wear a mask into the building, and we ask that you minimize any extraneous people there with you. If you are a parent of a young child or a dependent adult that requires your assistance, then of course you can bring that person to your exam or be present for their exam. However, any other kind of adults that can act independently, we'd ask to be seen by themselves, and that anyone driving them would wait in the car. This helps keep the number of patients in the office at a low level. Our waiting rooms are removed. We've removed most of the chairs from our waiting rooms, except for enough that people can maintain a 6-foot distance. And we're doing our best to minimize the amount of patients being seen. I shouldn't say minimize the amount of patients, but limiting the amount of patients being seen so that we try not to overflow the office. Because medicine is not always an exact science, sometimes a practitioner may get behind and we may find the office getting too crowded. At that point, we may ask oncoming patients or incoming patients to wait in their car until we are ready to process them. And we have seen that the practice census is reduced to the point where we can safely fit everyone inside. Moving forward, we want to maintain these same safe practices. We'll be using gloves on all patients. We'll continue to wear our mask. We'll continue to try to avoid excessively close contact. And we will hopefully be able to continue keeping our doors open to process all the patients that need to be seen, especially for those 10 weeks where Connecticut was essentially shut down from routine care. If you are a patient who requires cataract surgery, we are doing our very best to catch up from that backlog. And starting in September, we will be able to return to our near normal levels of cataract surgery volume from before the pandemic. Our surgery center has also taken extraordinary steps both in patient flow, in physician and staff location, and also cleaning and air circulation to make sure that we offer a safe environment. At this time, our surgery center is not requiring a COVID test prior to surgery because our center is unique in that we do not use endotracheal anesthesia. So there's no tube, there's no breathing tube. We don't have any non-ophthalmology procedures or surgeries going, so there's no endoscopy or other procedures that could create a salivary contact or any type of mist or aerosols from the mouth or sinuses. So yes, you will have that same screening that you'll see in the office, but you will not have to be tested for COVID at this time. So stay well, stay safe, and I'll see you in the office soon. Thank you. Bye-bye.